Hello, everybody. My name is Mercedes Bern-Klug, and I'm the coordinator of the Aging and Longevity Studies program here at the University of Iowa. I, I have a clock that makes the sound of a bird at the top of the hour. Sorry about that. The Aging Studies program offers a certificate for graduate students that takes 12 credits and a minor for undergraduate students for 15 credits. So if anyone's interested in more information about the Aging and Longevity Studies program, please don't hesitate to contact me. Today, we're going to hear from three panelists. They're going to be talking about careers in aging. This is Careers in Aging Month, and universities and colleges throughout the country are talking about possibilities in aging this month. So we will be starting off with Kim Bergen-Jackson. She's going to speak for about 15 minutes on nursing. Then we'll go to Rohit Nair, who's going to speak for about 15 minutes about dentistry, and then Jill Watskey, another 15 minutes on law. If you have questions, please put them in the chat box. And when the three of them have finished, I'll go through the chat box and pull out some questions. So I think we're about ready to go. Kim Bergen-Jackson, if you want to share your screen, I will just officially introduce you. Dr. Bergen-Jackson is the clinical associate professor at the College of Nursing here at the University of Iowa, and she teaches in the Aging and Longevity Studies program. She teaches health and aging and is widely recognized as an expert in long-term care and has been an administrator of a local long-term care facility for over 20 years, a nursing home with an excellent reputation. So, Kim, I'm going to mute myself. Take it away.
Well, thanks, Merce. I appreciate that. Hi, everybody. So I put some slides together just to talk about nursing, but I'll give you a little bit more background about myself. I have been working with older adults my entire career. I started as a certified nursing assistant many, many moons ago, transitioned to an LPN. I was a non-traditional student, so I worked as an LPN for 18 years before somebody told me I should go back to school and get my RN. I went back to school when I had two kids, which was a terrible idea, two toddlers actually, and then finished my PhD at the University of Iowa College of Nursing in 2013. I've been very fortunate to work with some amazing people. I've been teaching as an adjunct for years, but last semester in August, I made the transition to the University of Iowa full-time. So I left the clinical arena and now I'm teaching, and I'm very happy about that so far, but I still have my fingers everywhere when it comes to long-term care. And older adults need people to want to specialize in geriatric care. So I'm going to talk to you specifically about nursing, but I will say that it is an interdisciplinary field. We all rely on each other, social workers, rec therapy, music therapy, dentistry, medicine, and law. I mean, they're all very interconnected, and we need everybody to really provide the best possible care. So one of the reasons it's important in nursing is because people have conditions that they're living longer with, right? We have a growing population of older adults who are living longer. Life-limiting conditions such as cancer are really becoming chronic conditions. And so we're seeing people live longer with multiple comorbidities, and they're getting really complex. Their care needs are getting really complex, and they need some nurses in their lives to help them figure that out. I'd also say that we're seeing an increasing demand for specialized care. For instance, diabetes is out of control. We're seeing a lot of older adults who are receiving dialysis. Dementia is expanding just as rapidly as the population. And so there are a lot of situations where we need a specialization. I talked a little bit about this, but as people age, their needs change. So we're seeing a lot of physical needs for folks. Mobility, for example, but also chronic disease management. How does your treatment affect cancer diagnosis over a long term, right? It's not necessarily a fatal terminal diagnosis anymore. You may live for 20, 25 years with that cancer. So how are we managing that? We're also looking at sensory impairments, right? How does your world change when your vision and your hearing are decreased, when you use assistive devices, how accessible is the community, things like that. Cognitive needs, I briefly touched on already, Alzheimer's disease and related dementias. I was in a presentation today with the Alzheimer's Association, and she said 1 in 3 older adults will die with dementia. I just think of all the people I've taken care of over the past 25 years, and that number is astounding to me. So we need folks that are working at either end of the spectrum, early detection, care strategies, and support for families who are caregivers, but also end of life care, as the progression occurs, and again, support, helping with anxiety, depression, and loneliness. Social isolation, we really saw hit a peak during COVID when we were all isolated from each other. So we know how damaging social isolation is for people. That's why I'm a big fan of retirement communities, because you're sort of in your own little city. Can't say enough good things about end-of-life care. Hospice nurses are amazing, and support groups that support either the person who's aging or the person caring for the person who's aging. What do nurses do? Everything. Nurses can do everything. So I just put down some general things here. Assessment and monitoring are really important, even in someone with a stable health condition. Education and support, patient teaching, but also caregiver support. Caregiver burnout and stress is one of the biggest problems we see in older adult couples. And unfortunately, what we see is that the caregiving spouse will die sooner than the person who's living with dementia or a chronic condition, and then they're all alone. So really important that we are teaching not only self-care techniques, but caregiver techniques. Medication management, you've all heard about polypharmacy. I'm sure people can be on 20 different medications. That can't be good for anybody. So really looking at medication management, how to decrease polypharmacy, working with your geriatric pharmacist on the team, and teaching health literacy. One thing you'll learn soon is if you go into education with a medical background, you know a lot more than the general public. That sounds simple and sort of like a given, but I didn't really see it until it happened in my family, and nobody knew what was going on with someone who was on a cancer journey. And so my role became very different for health literacy and education. Remember that if you're building curriculum these days, this country reads at a 5th grade level. So that is crazy, but it's true. And so you have to keep in mind that all of that medical lingo has to be at a level people can understand. And then my biggest job is to advocate for what matters most to people, what makes a difference for them, so that they have some autonomy and decision-making capacity at the end of their life, no matter what their condition is. Pathways to nursing, a lot of people start as a CNA. You don't have to. I did. Then I was an LPN. That was a 1-year program. And in nursing homes, they'll let an LPN do almost everything that an RN does. And so no one told me to go back to school until they finally did. I went back to get my RN at Kirkwood, and then I transferred to the RN to BSN program. That was a great online program. Took 3 semesters to get my bachelor's degree. And then I went to the BS to PhD program. So there are a lot of avenues. Advanced practice registered nurses, nurse practitioners are very, very popular right now. It's specialized care. They can have prescriptive authority. They work with physicians and nurses to provide specialized care. You can get a master's or a doctoral degree for that. And then I put down a couple different avenues. So you can be a clinical nurse specialist, you can be a nurse practitioner, or a nurse anesthetist. There is a GERO certification. I have that through the American Nurse Credentialing Center. I got that by taking specialized courses and doing an exam. That certification goes for 5 years, and then I do continuing education to keep that up. I would say probably 1% of the nursing people in the world have that certification. It's really important that people see that you have a certification and that you're committed to the older population. Then you get to go to workshops and seminars and have hands-on training and internships in geriatric care. I would say I sort of lean closer to social work. I really appreciate what a professional social worker has to offer and complements the team. And so I work really closely with social workers. These are just some other options for students, internships and practicums. You can get involved in research if you like that. There are lots of studies on aging. I will say since I came to the college in August, I've had a lot of people knocking at my door because of my long-term care experience to contribute to their research studies. So that's been very exciting for me. And then I tried to think of all the different places you can work, and I'm sure I didn't hit them all, but hospitals, nursing homes, home health, hospice, and end of life care, which can be, as you know, in a nursing home or in a private home or in a hospital. Adult day health programs, sort of the anti-nursing home to keep people out of nursing homes, and then academic and research positions. What are the benefits of specializing in gero nursing? Well, you definitely have job security, right? There's a growing demand for professionals. I would say gerontological nurses, geriatricians. It's a small subset as a specialty. And with the aging population trending the way it is, there are stable career prospects, I think. For me, I love working with older adults. I think that what I do makes a difference in people's lives. That makes me emotional. My grandmother was a CNA, so I keep her, can you see that? I keep her name tag on my desk. She was a nursing assistant before they were certified. It says Lucille Puckett, nurse aide. That's to keep me grounded. What am I doing? I'm doing something to make a difference for people, no matter how I'm doing it. Um, and I like to know the whole story. So if you're somebody that loves to get to know people and loves to get into their story and you like storytelling and building meaningful relationships, gerontology is for you because I've known people, generations of people. I took care of their grandparents, maybe then I took care of their parents when they moved into the retirement community, and then I took care of them. So 3 generations of families I've been able to participate in. And I just like knowing the full story, right? So you could say I went into gero because I'm nosy, but what I'm trying to say is that you can truly provide compassionate care and you can make a meaningful difference in somebody's life every day that you go to work. And I've taken advantage of professional growth opportunities. So opportunities for advancement, specialization, and leadership roles. I've really grown in my capabilities over the years because I never say no to something that pops up as an opportunity. So I would recommend that, or some degree of that. Maybe not always saying no, but sometimes saying no. So I talked about how important it is. I talked about the different opportunities and the impact that you can make. I can't stress enough how I believe my life has affected other people. And it's simply because I'm working with this population and love and respect people, no matter how old they are or how ill they are or whether or not they have cognitive impairment. Everyone in my book has a voice at the table. Everyone has value and everyone should have autonomy and decision making. So that's my love story for older adults.
Thank you, Kim.
I
You
know.
certainly bring a lot to the table
Oh,
in terms of your background and your commitment and your passion and your enthusiasm for the field. So thank you very much.
thank you, Merce.
And, since we do have a few minutes here, if anybody has a question or a comment, we can go ahead and take that before we move on. Or just put it in the chat box.
Yeah, I'll answer anything. Just put it in the chat box and it's fine.
All right, let's move on now to Rohit Nair. And Rohit,
Merce, you're muted. Sorry.
no, I appreciate that. Rohit Nair. Dr. Rohit Nair is a clinical assistant professor in the College of Dentistry, and he has an advanced education program in geriatrics and special needs. And we're very happy to have him with us today to talk a little bit about opportunities in dentistry working with older adults.
Thank you. Thanks for having me here this afternoon, and I'm excited to talk to you all about the work we do and opportunities for future providers to join us and try to serve the oral health needs of older adults in Iowa and around. So, when people ask us who our patients are, I say it's the state of Iowa. Although we are located in the southeast part of Iowa, we see patients drive in from 3 to 4 hours away. And that's because there's a growing shortage of dentists who feel comfortable seeing patients with complex healthcare needs in their private practices in rural areas. And we're going to see more of that because the aging population of Iowa is only going to grow. It's estimated to reach 20% or north of that by 2060. And I was surprised when I saw these numbers, and I had these numbers on a slide a few years ago, and back then I was saying about 30 some percent of Iowans over the age of 65 were lived alone, and now it's 44%. So that family support and social support is also dwindling. And to serve the needs of all of these individuals, we have one dental school in the state of Iowa. So that's from where most of your dentists in the state of Iowa are coming from. And that's also the largest billing provider of dental care in the state of Iowa. So something to digest. At the same time, it's important that older adulthood brings with it possibility of disability, and the you can see on the screen here the numbers of adults over the age of 65 who had at least one disability, and you can then kind of superimpose that on oral health and see how lacking any of these faculties can also have an impact on oral health. So we are dealing with a complex patient population right off the bat here, and we need more people to join the field. So when you talk about numbers, if you looked at the number of dentists in Iowa per 100,000 of the population compared to the national average, it's about half the number of dentists per 100,000 of the population. So immediately, for a rural state like Iowa, we are predominantly facing a shortage of dentists. Now, sure, you can have counties where you have a larger concentration of dentists, say, Johnson County because of the dental school, or Polk County or Lynn County. But apart from that, there are 21 health provider shortage areas, high priority dental shortage areas in the state, out of 86 counties, are considered high, what we call HIPSA areas. And the problem is compounded more in rural areas because the spread of dentists is pretty uneven there, and there are limited resources. There are fewer dentists. Transportation issues abound, and access to local resources are fairly limited. So there's a shortage in the workforce. We have about 2,200 or so active dentists and about an equal number of dental hygienists. And typically, you would see more hygienists for the number of dentists. So that itself kind of speaks to the kind of shortage that we have in this area. There are several barriers that keep our older adults from getting the care that they need. On the provider side, there is, like I said, a shortage of dentists who are trained in care for patients with special healthcare needs, including older adults, patients with dementia, and things like that. And I'll talk in a little bit about what our program does to address that critical gap in our infrastructure. On the patient side, in addition to all of the barriers that Kim, mentioned just now. Medical complexity is one of the issues. Transportation issues. Oftentimes, patients need 2 to 3 days notice prior to changing an appointment because they've also got to arrange for transportation to get to our office. And then once they get to the office, there are mobility issues. Does the office have a wheelchair lift if they do not transfer from a wheelchair to a dental chair? Does the office have a Hoyer lift if someone has to be transferred from their wheelchair into the dental chair safely? So that's a big barrier, engineering barrier, if you will, on its own. And then at a systemic level, older adults tend not to have as much dental insurance as people who are normally employed, and so the availability of insurance is limited. And even with the insurance that's available, it's low. The reimbursement rates are fairly low, especially if someone was um, on public dental benefits. Benefits are capped at $1,000 annually, and a lot of people don't realize. Speaking to that health literacy point that that we just heard about, dental insurance doesn't work like health insurance. It's in fact the opposite of health insurance. There's an annual maximum on how much care you can get, and then after that, it's all out of pocket. And so a lot of times, patients will also confuse Medicare Advantage with Medicare, regular, and assume that they have coverage for dental care through Medicare, and pretty soon, they're in for a shock when they're told that they don't have those kinds of services available, and they're going to have other sources of funding that kind of care. So there's barriers facing this population. Now, when we talk about the safety net as far as dentistry goes in the state, we've got, of course, the Iowa Dental Wellness Plan. That's the state Medicaid program for dental services. Iowa is one of a few states that has comprehensive services under Medicaid. In a few counties, I think in about 10 counties, there's a demonstration project along the lines of what they call iSmile for Kids. This is iSmile Silver. And what it does is it enables residents of that county to contact a coordinator who will then put them in touch with dentists who participate in the program and are able to provide services to them, and so on and so forth. So it's still pretty limited in its reach. We have the College of Dentistry, which, like I said, is the largest biller of Medicaid services, dental services in the state of Iowa, and we've got 300 student providers and faculty providers and residents providing all levels of care to patients who enter our doors and who participate in programs that the college visits outside. We've got several federally qualified healthcare centers and CHCs in Iowa, but only 13 or 14 of them have actual dental services on site or on a contracted basis. So although there's a vast network of primary healthcare outlets, the dental care delivery aspect itself is fairly limited through them. And then for our indigent older adults and poor older adults, we've got institutions like the Free Medical Clinic of Iowa City. There are several such free medical clinics across Iowa City, across the state, and then availability of healthcare of dental services is spotty at best. Some don't have dental services, some do. The key to remember is all of those services and all of those entities are only as good as the number of providers who are participating in them and who are able to provide services through them. So and that's what we focus on in our role as the primary provider of dental education in the state of Iowa. So I work in the geriatric and special needs clinic at the College of Dentistry, and we serve three patient groups. We serve older adults with complex health history, so we don't have a chronological, cutoff for patients to be in our clinic. They could be someone who's 50 years old and has complex health issues, and we acknowledge that this is someone who's going to have even more issues as they grow older, and especially with oral health. We work with adults with special healthcare needs, and then we have a program where we go out to nursing homes and provide care on site. I think about 10 nursing homes in the Iowa City area. We have 10 students at any time in our clinic, and that's a year-long rotation. And so all of our 80 dental students who are enrolled in the D4 year go through our clinic, and we have them seeing 3 to 4 patients a day. So that's about 40 patient visits a day just coming to our clinic. We've got 2 full-time residents, 5 faculty, and we've got assistants and hygienists. And like I said, we provide care on-site at the College of Dentistry and off-site at various nursing homes. We provide a host of comprehensive care services, and we are able to accommodate patients who use wheelchairs, motorized wheelchairs, who cannot transfer from wheelchairs. So we've got accessibility aids like portable wheelchair lifts where we can just move our regular dental chair out and then have them move into the wheelchair lift and then just rotate them back and be able to provide care in a safe and comfortable manner without having to move them to the dental chair. We provide a number of other patient assistance services and especially anxiety management, and a lot of our patients benefit from these. Like I said, a key aspect of our outreach work is the geriatric mobile unit, where we go out to nursing homes and set up all of our equipment and provide care of the same quality and extent that we would provide at the College of Dentistry. It's an award-winning program that's been in place for several years now, and our students, have a great experience through this, and so many students feel like they feel confident they can go out after graduating and start providing these services at nursing homes. So I used to serve on the admissions committee at the College of Dentistry, and one thing that I always noticed with our applicants was their strong history and interest in volunteering. And so I noticed that a lot of our applicants would volunteer as nursing assistants in long-term care facilities. They'd have office experience, of dealing with insurance and direct care provision. And then they also come from close-knit families, so they've grown up with aging family members and great grandparents and all of that. So they're aware firsthand of the challenges that a lot of their older adult neighbors might have faced in accessing dental care. So to become a dentist, you would have to earn a bachelor's degree. You fulfill some prerequisites. Take the what we call a dental admission test. It's a standardized test, and then apply to any number of dental schools. You'd complete dental school. That's a 4-year program, and then you'd have to pass a bunch of licensure exams, and then some standardized tests again from accrediting agencies, and then that would lead you to obtain your licensure through the Iowa Dental Board. And then you're at that point ready to practice in private wherever you would choose to. But a lot of dentists do consider going for advanced training. While you're in dental school, the way we've structured it is that we have our students exposed to patient care right from the first year of dental school. So they're getting in there and they're getting that experience that they need to be able to be comfortable seeing patients in their second year and third year, where they're really honing their skills and becoming comfortable with individual procedures. It's in that third year of dental school when they start getting some geriatric dentistry experience didactically, and they learn how to think about social modifiers that affect patient care and figure out what the difference is between ideal treatment planning and rational treatment planning, meeting the patient halfway and figuring out what works best for their situation, especially for our older adults. And then in their final year, they spend 5 full weeks in that clinic that I just showed you pictures of, and they see patients all the time. They see patients with us, and then they go out to a nursing home. They drive up to Cedar Rapids if that's where our nursing home unit is at, and then they provide care offsite at those sites. They also go out to extramural rotations around the country, and they have opportunities to see older adults, sometimes from the veteran population at VA sites, and they come back confident that they'll be able to provide care to this patient population. Now, if you choose to do some sort of an advanced specialization, one option is doing a certificate in geriatric and special needs dentistry, like we offer. There are 4 or 5 such programs across the United States. It's not recognized as a specialty as such, but there are strong advocacy efforts that are working towards having it recognized as a specialty. Again, you'd have to complete your DDS degree. There are several standalone programs focused especially exclusively on geriatric dentistry, like ours, but there are also programs that are offered in conjunction with a dental public health degree. And now I would say, as someone who did a geriatric and special needs certificate myself, having some kind of a foundational knowledge of aging and aging studies helps immensely. It really prepares you to work with this patient population. And eventually, it's possible for you to join organizations like the Special Care Dentistry Association or the European College of Gerodontology and be recognized as a fellow or a diplomate of these organizations for the work that you do, and also benefit from very high quality continuing education. It's not just as a dentist that you can serve older adults. You can serve older adults in the dental profession as a dental hygienist or a dental assistant. To become a dental hygienist, you'd have to complete your high school or general education diploma. enroll in a CODA accredited program. CODA is the Council on Dental Accreditation, and that's offered through a number of different community colleges. Kirkwood, Iowa Lakes are some examples. You'd pass some standardized licensure examinations and apply for your licensure. I believe it's a 2-year program, and then you maintain your license through continuing education and renewals. Now, it would be nice to have something more specialized in here, like gerontological hygiene, but we don't have quite that in dental hygiene. What we do have is organizations like Special Care Dentistry Association have fellowship tracks for hygienists who work with older adults and adults with special healthcare needs. So that's a great opportunity to showcase your achievements and achieve that extra qualification, and then benefit from continuing education and leadership opportunities. As an assistant, again, you would complete high school, enroll in an assisting program. There are formal programs, or the state of Iowa also allows on-the-job training. Working as a dental assistant in a private office, you would pass your required exams. And then apply for registration with the board and then maintain that registration. Here again, there isn't much scope for specialization, but I can tell you that my work with older adults wouldn't be possible if I didn't have the kind of assistance that I had. So that's what I have for you about all of the different pathways that you can choose within dentistry to serve older adults. Happy to answer any questions you may have, and I have some links to resources that you might want to look at if you're interested in geriatric dentistry. Thank you.
Thank you so much. A lot of information, and what a need. You've really convinced me that our state is short on dentists, and there are pockets throughout the state that could really use a little bit more help. Thank you very much.
Thank you.
Let's move on to Jill Watskey, who's going to talk a little bit about law and serving older adults. Unmute yourself first, please. You're
Merce?
Yes, now I can
Am
hear
I
you.
unmuted? Okay.
You're unmuted.
I was gonna give a compliment, so I better do it again. Kim and Rarit, I hope I'm saying your name correctly. You guys were awesome, and I've been listening to this, getting fired up, and also kind of wishing, though I love my work very much, especially with the dentistry thing. My dad was a dentist, though he didn't try and push me into it. Actually, he did quite the opposite. He said the work was too hard. But he's long since retired, and he had no good dental assistants or dental hygienists down in rural southern Missouri where he was practicing. So the hygienists and the dental assistants would definitely help. So I'm a little different from my two predecessors here, in that I'm not a professor. I am simply an attorney in private practice. I'm a solo practitioner. I don't even have a support staff. So I have no assistants. Why have I set my practice up that way? It's because I'm an elder law attorney. I help all people, but my passion, my focus is helping older people, whatever that means, whatever age that is, kind of like Rarit said, no hard and fast cutoff there. And in my opinion, after doing this kind of work for 25 years now, it's been 25 years exactly, what I always say to people, though law students don't always like to hear it, is, in my opinion, if you do this work the right way as an attorney, you're not going to make a ton of money. If you do it the right way, building the relationships, listening, making the extra trip to see a client in a care facility in Amana, because the first time you went there, she was not having a good day. And at that time did not have the mental capacity needed to understand and properly sign her power of attorney. So at the same time, though I'm not like most attorneys you hear about and read about and see on TV, and that I'm not making money hand over fist. I think you'll be hard pressed to find an attorney who's happier with her work than I am. And it's been that way for a long time now. And I've had to reinvent myself many times. Like Kim, I'll just tell you a little bit about my past, and that, like a lot of people, I went to law school because I wanted to be helpful. I wanted to have the tools to be an advocate and do things and help people. And law school, I know this is going out for anyone to watch on down the road. I would say most people who work at law schools would say, yeah, we're still probably not doing the best job in making sure that when our graduates leave us, they are ready to go out and do helpful things. Many jobs within the law are not set up, actually most of them are not set up to help individuals who are down and out, whether it's because they have disabilities, they don't have a lot of money, they live in a rural area, or in my case, because they're older. There was nothing about my law school experience back in the 90s, and I'm not from Iowa. I just moved here 3 years ago, so I'm not saying anything about our law school here. There was nothing about my law school experience back in the mid 90s that prepared me to be an elder law attorney, other than it showed me many things that I knew I didn't want to be. So what I figured out, I knew I wanted to help people. So how did I do that? I got the one job, because I knew I didn't want to do criminal defense work. But I got the one job I thought could make me happy. And that was, I was in Kansas City at the time, working at legal aid. So I started out as a legal aid attorney, working on housing issues for people with disabilities. It wasn't exactly what I wanted because it was grant funded. And when I was spending more time working on writing those grants and doing the reports than I was actually doing the work. But then here's where I got lucky. I stumbled upon an attorney who had just started practicing in the field of elder law. This group of people had started a decent sized firm in the Kansas City area. I heard them talk about their work. They sounded very much like Kim did, like Rohit did, in that they talked about, especially Kim, with what you said. Because I know, Rohit, it's harder to talk to your patients because you can't talk when people are working in your mouth. But like with what Kim said, wow, if you love the stories, and older people have the best stories. The longer you live, the more stories you have to tell, the better they get, the more interesting they get. Older folks are the best storytellers ever. And that's what I heard at this conference I went to when I was about 29 years old, legal aid attorney, wasn't quite feeling like I was making the difference I wanted to make. And I heard this attorney say, yeah, what I do is probably about, 50% social work, 50% legal work. It's really about listening to your clients and what's important to them, and then crafting the estate plan or the documents that they need to help execute that plan. And I said, you mean there's a type of law where I can work with people who are like my grandparents? Because remember, I'm only 29 at the time. And they said, yes. And I said, well, I don't, wills, trusts, powers of attorney, I don't even know what that stuff is. I don't know anything about it. And they said, Jill, that's the stuff you can learn. We can teach you that. We can't teach you to appreciate and care about older people and want to hear their story. So if you're into that, come join us. We'll figure out all the rest. So that's what I did. I've been doing it for 25 years now, but because my partner is an academic, like some of you, and has taken new jobs from time to time, I have had to recreate myself, which is hard at the time, but has helped me learn so much more than I otherwise would have. So I have practiced in the states of Kansas, Missouri, Oklahoma, and now Iowa. And in reinventing myself, like I said, I started with a private firm, learned a ton. I mean, we thought we were cutting edge, and maybe we were at the time. In the year 2000, this term elder law, you know, a law practice, and I'll talk a little bit more about what I think that actually is. You know, this term was relatively new. It wasn't being thrown around a lot. There were no elder law classes in law schools, at least none that I knew about. So we felt like we were doing something really important and cutting edge. And we were, I learned a ton, but then there were some things, the money-making side of things that I didn't care about so much, where I thought sometimes, because of course I wasn't in charge, I wasn't running the firm. There were some things, I think we could do this. I think we could do this better. I think, you know, we have, you know, we could pay less rent. We don't need to have this fancy office. You know, we probably don't need to have quite this many legal assistants and paralegals. We could stream this down a little bit. So eventually I worked for a couple nonprofits when we moved. Had some great aspects to that as well. But then, like I said, with the legal aid thing, I'm working with the clients here who really need help that I want to work with. At the same time, sometimes my hands are tied because our grant funders only want us to prioritize this, but I'm getting calls for this, and I can't help people with this because my funders say it's not a priority. So I have to say, I'm sorry, no, I can't help you. And worse than that, I don't know where to send you because no private firm is going to help you. And our nonprofit isn't going to either. This is why I started my own thing about 10 years ago. Unlike Kim, who was very industrious and went back to school when she had 2 toddlers, when I had kids who were ages 2 and 4, I decided, you know what? Time for me to strike out on my own because I need to be able to set my own schedule, and decisions I make about the services I provide need to be only between my clients and me, not determined by how much money I may be able to make for a firm, not determined by what my nonprofit donors want me to do. So I've been at the solo practitioner gig for about 10 years now, mostly in Oklahoma City, just getting going here. And I'm hoping that you guys help me meet some of those people that I need to meet who really need the help. So you know, Merce had asked us to talk about specific things, you know, needs that accompany older adulthood that can be addressed by lawyers. Kim talked about this. And Kim, I know you're muted, but I think you talked a couple times about autonomy in decision-making. I consider that if there was one thing I do that's most important, but probably valued the least just by people in general, because they don't get it until they've been through it. The thing I do that's most important is sitting down. Of course, I can sit down with people of all ages. I tend to sit down with older adults and make sure that they have the documents in place so that their wishes are going to be followed while they're still living, in the event that they are not mentally well enough to make those decisions themselves. And here I'm talking about things like powers of attorney, durable power of attorney for finances, for healthcare, you know, also an advance directive, or sometimes they're called a living will regarding what someone's end of life wishes are. Would they want artificially supplied nutrition and hydration? If at least 2 healthcare professionals have determined that they are incapacitated with no chance of recovery. So I do a lot of that stuff, and that stuff, you know, arguably is something that any adult should consider, but most of us don't even think about stuff like that until we're in a crisis situation. And of course, for those of you who have been through this, if you're caring for a loved one, regardless of their age, and they have an illness or an accident which makes them mentally incapacitated in such a way that they will never get better, or the dementia has progressed, if they don't have a power of attorney in place for me to continue to care for them, I have to be appointed by a court as their guardian and conservator. I can still care for them, but now it's no longer a private matter. I have to file reports with the court. It's expensive, it's time consuming, it's always a last resort. And typically it's so easy to avoid it by just getting powers of attorney in place. So, and I know Marissa, what, five minutes left? Okay, all right. So, that is probably the most important thing I do. It's very rare though that anybody calls me about that. What usually gets them in my door is their concern about what happens to their stuff after they die. What happens to their assets after they die? Because that's what, at least in my experience, what most older folks are worried about. I mean, they have no intention of becoming ill or losing their mental capacity or their capacity being diminished. And usually what gets them to call me is they've decided, my gosh, their brother-in-law recently died and hadn't done any estate planning and things were a mess. And now the kids are fussing about this and that. And the lot was supposed to always go to the oldest boy, but nothing was ever done. They just talked about it. So that's a big part of what I do as well, working with people to ensure their wishes are followed after their death. Things like wills, last will and testament, or revocable living trust, or it can be very simple. And that's what I love, is making things as simple and cost effective for people as possible. And clients love this stuff. Most people hate attorneys, and oftentimes, sadly, it's for good reason. Oftentimes, not always. And Merce, I know you mentioned to me your husband was an attorney, so I know there are good attorneys out there. There are, but my heavens, where are they? We need them serving the older folks. I've been here in Iowa City now for 3 years, and you guys are going to have to tell me who the elder law attorneys are in this town, because I'm not finding them. I would love, I don't want to take any business from them. There will be plenty to go around. I know there are many firms that do estate planning, and then they throw in there that also they do elder law. Sometimes that is no more than a marketing technique, because again, as you guys both pointed out, Kim and Rarit, with people getting older, it can be good for business to say, oh yes, we do elder law as well. But is that what their passion is? Is that what they specialize in? Because it is a different sort of law in that to do these powers of attorney, to do a will or a trust, any kind of estate plan, especially for an older person, especially if they are ill, if they don't come to me until they're ill, if they don't get to me until their capacity is somewhat diminished or diminished at times, certain times of the day, certain days, then it becomes a lot harder. But I don't mind that. That's why I'm doing the kind of work I'm doing, because my job is to sit down with these folks and listen to the story. And in some ways, though, Rarit and Kim, I love it that you guys have the skills, being in the medical and dental professions, that you can heal people. People come in pain. You have the ability and knowledge, at least at times, to help them and help them quickly. I so envy you guys for having that kind of skill. Mine is a longer process, giving peace of mind, ideally at the end of our time together, to my clients, by helping them map out a plan that meets their wishes, both for what happens to them while they're living, what happens to their things after they die. But for me to get to that point where I can really help them usually requires multiple conversations. And I think that's what's hard about the legal profession in general, that most attorneys' offices are not set up to do that, because also most of these people they're not going to come in and get help from you. Because if you have a toothache, it's a different thing. Do you really want to come to a lawyer just for the heck of it, unless you really understand what value they bring? Less likely to do that. So once they have reached out to me, I want to make sure they, if they want to, that they stick with me and we get it done. So, it's pretty hard to charge for repeat visits just because you're working with someone who has dementia and they can't remember in full the plan you went over the first time. So we get together again. And I know now I'm getting very short on time. Kim, I'm like you, I get excited. And, so Merce, you said just whet their appetite. So that's what I'm trying to do here. No better area of the law to focus in if you love the stories, you love people, and you especially have a thing for working with older people. And the thought of working with folks, let's say with dementia, you just find interesting and challenging. I know what I do is a real conversation stopper for a lot of people. You know how maybe you'll be visiting with someone somewhere and you're really not going to continue to have a relationship with them. You're just visiting in the moment and say, oh, what do you do? And I used to just tell them I was a social worker, but then I didn't want to be demeaning to social workers by suggesting I was a social worker without the training. So I started saying, oh, I'm a lawyer, and they're like, oh, well, what kind of law do you do? And I think they're waiting to hear that I bring, class action lawsuits, or I'm a criminal defense attorney. Have you seen me on TV? And I say, oh, I'm an elder law attorney. Usually people say, oh, and then they just go on to something else. And I think, isn't that the darndest thing? Because I think it's the best thing ever. I've got so much I'd like to talk about, and I'm so sad that did not get you excited. But once in a while, boy, you can tell what people, if they have been through it, and you say you're an elder law attorney, they say, oh my God, I went through this with my mom 2 years ago. I wish I would have known you then. So, it can be really great. Also, I help people with long-term care issues. Rohit, you mentioned, how surprising it is for some of your patients to learn, oh my gosh, Medicare isn't going to pay for this. Same thing with so many of my clients. They think Medicare will pay for a nursing home stay. Well, maybe if you're going there, for rehab, you're going there for some physical therapy, so long as you show continued improvement, it may pay for a portion of the first few days, but not the long term. So I work with people on, hey, what's your asset situation, your income situation? What do we think your healthcare needs might be? Or was anyone a veteran? Could there be VA benefits that we could access? Do you have long-term care insurance? Usually it's me talking about how Medicaid works, the division of assets, if you're part of a married couple, spend down, that sort of thing. Merce, I realize that I have not talked about education and training or opportunities for students, but will the people who eventually listen to this, will they have access to our contact information? Or maybe not everyone. Sure. I'm fine with people having access to mine, because I'd be delighted if someone actually saw this and thought that my, all over the map presentation made them excited about this. I will talk to them for as long as they can stand one-on-one.
I'm excited.
Okay.
But let me just clarify. So in order to apply to law school, you must have an undergraduate degree. And does it have to be in a certain area?
So Merce, yeah, thank you. And I'm glad to keep talking if you've got questions related to my thing here. So yeah, so to apply for law school, you do have to have the typical 4-year bachelor's degree. It can be in any major. There are, engineers who go on to law school. You could have a degree in nursing, English literature, art history, political science, all over the map there. And then to get into law school, you have to take the LSAT, the law school admissions test, similar to other professional schools. And then law school is typically a 3-year program. But, unlike it sounds like with nursing and dentistry, at least as of this time, you will be hard pressed to find a law school who will offer you any kind of elder track opportunity. I know some law schools offer the elder law certificate. I know Iowa College of Law recently hired, I think just this year, someone who specializes in elder law, who is now on the faculty. there. But, you know, overall, I don't think it's considered a super popular field. So I welcome you, as Rohit said. I don't have the stats like he does. No shortage of work to be done. You may just have to be creative in finding a way to do it, reach the people who need your help, because usually they're not going to come looking for you, and then find a way to make you know, a decent living, you know, balance that money and happiness thing. Yeah.
Thank you so much. I want to thank each of you for telling us a little bit, giving us a taste of what it's like to work with older adults in nursing and dentistry and in law. I think I saw a question. We have about 4 minutes. Let's see. What type of additional learning have you been inspired to pursue as a result of your experiences with older adults? Rohit, do you want to take a crack at that? What type of additional learning have you been inspired to pursue?
Sure. I'd say, I came to geriatric and special needs dentistry because after I graduated dental school, I went on to do my master's in prosthodontics, which is the art and science of replacing missing teeth. And, by virtue of the fact that that demographic tends to be heavy with older adults, I started working with a lot of older adult patients. And it was then that I started noticing other issues, like comprehensive care was an issue. And, I'd sure I'd be replacing this tooth, but I'd be noticing something else going on somewhere else. And that's what got me interested in older adulthood and what issues might come up. So I pursued my diploma in gerontology at that point, or aging studies, and that gave me a good social context and understanding of problems facing older adults. And then I went on to pursue my geriatric and special needs dentistry certificate here at the College of Dentistry. So it's been a stepwise progression, and it's done a lot of good for my career, and I enjoy serving that patient population.
Wonderful. Kim, you put a little something in the chat box, but would you mind just saying it out loud?
Sure. Yeah. I think I pursued, well, who knows? I applied for the PhD program not intending to get in, and then got in and was like, how did that happen? So I think some of it was a little bit impulsive, but what I've learned since I received my degree is that people listen to me more now than they did before, which isn't a great thing to say, but it's true. So I have the ideas and the opinions that I brought with me as a CNA and an LPN and an RN, but I come with a bigger signature. And so I just really would like to make things better for older adults, and particularly for me, older adults who are living in some sort of retirement community or nursing home. So I like to root for the underdog, and I found a place where I can position myself and talk articulately about what people need and what they deserve. And it shouldn't be based on their ability to pay. It should be based on what they want and what matters to them. And so I can get really passionate about it. And now people have to listen to me. So, in my next life, I want to be a lawyer. So Jill's got me all worked up about that. And I could also see myself in dentistry school. So maybe I'll just keep going to school forever.
Just keep lifelong learning.
Just lifelong learning. That's right.
Jill, how about you? Have you been inspired to pursue additional education on account of the experiences with older adults?
Well, I mean, yes, I actually am all the time. From the time I started doing this, I have wanted to pursue like true formal additional education. Merce, I think when you and I first got reconnected a couple weeks ago, I think I told you I was so envious of the social workers I was working around when I was first an elder law attorney that I highly considered going back to school and getting a master's of social work, or, one of your former colleagues tried to get me to get a PhD. Sadly, I think it was John who asked this question. I didn't get my law school debt paid off till I was 45. due to my non-lucrative career choices. So pursuing additional formal education is not something I have done, though I constantly educate myself by hanging out with as many older folks as possible and putting on my listening ears and getting all the education I can get from them. But yeah, if I had all the time in the world and money wasn't an issue, I mean, I want to go in I want to be a dentist and work in the mobile dental unit now. I mean, how amazing would that be?
That mobile dental unit word I wanted to say is incredible. As a provider who used the service, it's incredible. Not just during COVID, but all the time, to be able to bring high class quality dental services into people who can't get out anymore. I cannot state the value of that service. It's incredible.
Yeah. Thank you.
Wonderful. Well, there goes my birds again, letting me know it's the top of the hour. I do want to remind folks that the University of Iowa has a very strong law school, a very strong dental college, an exceptionally strong college of nursing with an emphasis in gerontology, geriatrics. And we also have an undergraduate social work degree program, a master's degree program in social work, and a social work PhD program. And our MSW program is also available online. So the Aging and Longevity Studies certificate is available to any person who is at the graduate level, whether or not you're pursuing a degree. And please do not hesitate to contact any of us if you would like more information. And I want to thank everybody for being with me here today.
Thanks for asking, Merce.
Yeah,
Thank you.
thanks, everyone.
Thanks.